Mindfulness is a term that basically encompasses bringing attention to the present moment without judging it as good or bad, but just noticing with some curiosity what's present in this moment. And mindfulness meditation is a way to foster that awareness by repeatedly bringing attention to a particular anchor of the present moment. For many people, that might be their breath or some other sensory experience. You can practice mindfulness meditation in a couple of different ways. So there are informal ways to practice the mindfulness where you might choose something that's in the present moment, maybe your breath or your senses, sense of touch, taste, sound, or sight, and begin to bring attention to that, just exploring what's there. You can also practice formally, which is what people usually think of when they think of meditation. And in the formal practices, you set some time aside and sit with a particular anchor. Again, for many people, that might be the breath. But you repeatedly return to that anchor and begin to build that muscle of present moment awareness. There are a couple of ways that mindfulness can begin to help with your pain. One is counterintuitively beginning to turn towards the experience of the pain, noticing it, making some room for it, and maybe describing to yourself what it feels like if you're able to be with the pain in that particular moment. In addition, one way mindfulness can help with pain management is by noticing our thoughts that might add to the distress of the pain. So you might notice that you catastrophize and worry that the pain might get worse, or you relate it to some other experiences you've had in the past. And with mindfulness, you can just come back to the present experience of what the pain is like in this moment and release some of the stories that might go along that add to your distress. When the pain is either severe enough or bothersome enough that it's interfering with your normal functioning or your optimal level of functioning. And also another sign could be if the pain is associated with other symptoms that would warrant attention, perhaps symptoms of a heart attack or symptoms associated with a stroke. But always remembering that the pain is a way that our body is communicating some information to us.